Okay, welcome. Thank you all for attending. Welcome to the Missouri Association of Area Agencies on Aging training on HIPAA and privacy laws. This is a training for area agencies on aging involved in the MA4 network and their partners who deliver programming to clients, and for those who may come into contact with personal information in the services that they deliver. In the Missouri Association of Area Agencies on Aging network, all involved individuals are required to complete an annual HIPAA training, and this training will count towards that contractual requirement. We will issue certificates for individuals involved in the MA4 network who complete this training, and we will monitor completion. Completion will include monitoring active time in this webinar through completion and completing quizzes that will occur throughout the training with at least 80% of your answers being correct. Our presenter today is Scotty Allen. I'd like to introduce him. Scotty is the General Counsel for the Missouri Veterans Commission in Jefferson City. Scotty has 20 years of legal experience, including previous jobs with the Missouri Attorney General's Office and the Department of Social Services. Scotty is a native of Springfield, Missouri, and a graduate of Southwest Missouri State University and the Washington University School of Law in St. Louis. He is licensed to practice in both Illinois and Missouri, as well as the military courts of the United States. Scotty and his wife Jody are the proud parents of 4 children, Jacob, Billy, Alexandria, and Stella. Scotty will be speaking with us today about the intricacies of confidentiality law with an emphasis on the Health Insurance Portability and Accountability Act of 1996, otherwise known as HIPAA. At the end of the presentation, participants will be able to identify common HIPAA compliance issues and the appropriate response to each. We will have a Q&A session at the end of his presentation. So if you have questions, please enter those into the question box, and we will get to those at the conclusion of the presentation. So now I will hand it over to Scotty. Thank you, Scotty.
Hi, good afternoon, everyone. Once again, I'm Scotty Allen. I'm the General Counsel at the Missouri Veterans Commission. Prior to coming to work here at the Veterans Commission, I worked at the Attorney General's Office, and prior to that at the Department of Social Services. So I've been grappling with HIPAA and confidentiality law for a number of years now, and so hopefully I can impart a little bit of that knowledge to you all today. Next slide, please. Just a little roadmap of where we're going to go. We'll talk about what HIPAA is, what it prohibits us from doing, what is a breach, what do we do when there is a breach, how do we legally share information under HIPAA, and then we'll wrap it up with some participant rights under the law as well at the end. Next slide, please. All right, HIPAA comes in 3 parts. This is not the most user-friendly law that you'll ever come across. It's a little bit confusing in terms of how they've set it up, but it comes in 3 parts. Part 160 is all the definitions. It talks about compliance inspections, penalties that can be applied, and enforcement actions that can be taken against you. Really about the only reason to get into Part 160 for you as a practitioner would be to look at the definition section and see what the key terms mean. But here's where it gets a little confusing, because within each part there are different definitional sections as well. So you basically have to check both. You have to start with 160 and see if the term is defined there. If it's not, then go to the specific part that you're dealing with to see if it's defined there. So like I said, not exactly the most user-friendly system out there. Part 162 is all the unique identifiers and electronic codes that are used to communicate back and forth between healthcare providers, healthcare insurers. And so really these things are set in stone by the federal government. So there's really no reason to get into them unless, of course, you just need to find out what the code is. But this is all set in stone. No one can change it except for the Secretary of the Department of Health and Human Services. So it's a done deal, so to speak. 164, though, that's all your security and privacy requirements, all the rules on how information gets protected, who you can share it with, under what circumstances, that sort of thing. So obviously, Part 164 is going to be the focal point of our discussion today. Next slide, please. So a little generational joke, going back to the days of my youth, we're going to break down Part 164. And you can basically break it down into 2 parts, the security rules and the privacy rules. Next slide, please. The security rules, this is really handled by your IT folks. This is all of the electronic measures that must be taken to protect information whenever it's being shared across electronic systems. So it's like your malware, encryption software, that sort of stuff. So this is really, hopefully you've got an IT person on staff that handles all this stuff for you, or you contract for those services, because this is the highly technical IT stuff that I personally don't get into myself. Next slide, please. The privacy rules, though, that's the part of the rule that applies to all of us. It clarifies how an individual's health information can be used, how it's to be handled, when it can be shared with whom, what happens whenever there is a breach, so on and so forth. So this is where we're going to focus our attention today. Next slide, please. Who does HIPAA apply to? Well, it applies to a covered entity. And if you went to the law itself to find out what a covered entity is, again, this isn't a user-friendly law. You would actually have to go to 3 different definitions to figure out what a covered entity is. I've done you the favor of piecing it all together here on one slide. And it's basically, a covered entity is either a health plan, and that would be like a health insurance plan, or maybe Medicare or Medicaid, TRICARE, that sort of thing. A healthcare clearinghouse, or a healthcare provider that transmits or receives health information either electronically or in hard copy form. So for all of you out there, you're probably going to fall under that healthcare provider definition. So your organization would definitely be a covered entity. Next slide, please. Now, there are different types of covered entities out there. You have the single covered entity, and then you also have the hybrid covered entity. And the best way to think of covered entities is to think of a bubble. And so if you have one single bubble, that would be a single covered entity. But if you have a hybrid covered entity, as you can see there on the slide, I've given you a picture of 2 bubbles that are conjoined. And that's what a hybrid covered entity really looks like in terms of how the information can be shared. So within those 2 bubbles there, what you've got is essentially 2 separate bubbles that just happen to be joined together, and you've got that membrane in between them. And so if one half of that bubble is the covered entity part, as long as the information doesn't cross through the membrane into the other bubble, everything's fine. And so you see this sort of arrangement with organizations that do some healthcare, but then they also do other things here in the state government level. Our friends over at the Department of Health and Senior Services have elected to go with the hybrid covered entity arrangement. So parts of their organization are covered entity, is a covered entity, while other parts are not. So maybe some of your organizations out there operate the same way, because you also do other types of services. So maybe you have this kind of arrangement, but I would fathom to guess most of you have probably gone with the single covered entity arrangement. And really, to me, that's the system that makes the most sense, especially if your organization's primary purpose is to provide healthcare. That way, that information can freely flow throughout the organization, and everyone who needs it can gain access to it easily. Next slide. So within this covered entity arrangement, the key thing to keep in mind is that membrane. So as long as the information stays within that wall, that membrane, everything's fine. It can bounce around in there, go to all sorts of different people. So you don't need to get disclosure authorizations to share information with their coworkers. Now, if you're going outside of that membrane into another organization, that's where you're going to need either an authorization from the person or a legal reason to do it. And we'll talk about what the legal reasons are here very shortly. Next slide, please. Now, the downside of going with that single covered entity arrangement is everybody in the organization is subject to HIPAA, regardless if they touch the health information or not. So that's the only downside of it, is you have to make sure your entire workforce is up to speed on how this information is to be treated and how it's to be protected. Next slide, please. Now, what exactly is PHI? Well, again, this is not a very user-friendly law, so you have to kind of look at several different definitions. Again, I've done you the favor of putting that all on one slide for you, but it is individually identifiable health information that's either transmitted or maintained electronically, or transmitted or maintained in any other form or medium. This definition somewhat amuses me because basically the whole purpose of HIPAA was to turn the healthcare industry electronic, so that it would be no more paper files, everything would be done electronically. And as you all are well aware, we are a long way from that. And so I think someone at the end, whenever they were putting this all together, said, hey, wait a minute, paper does still exist. So they threw in that little bottom bullet there, transmitted or maintained in any other form or medium, just to remind us that paper is still protected. And so periodically, the feds that enforce this law will do a paper enforcement case to kind of shake us all up and remind us that paper is to be protected as well. And probably the most amusing or interesting one to me personally was back around 2012 or so. There was a doctor who apparently had a falling out with the medical practice that she worked for, and so she quit. And to get back at her, the medical practice took all of her patient files, boxed them up into boxes, and then just left them in her driveway. Middle of the day, just left them unsecured out in the middle of the driveway. And so to get back at them, I suspect it was the doctor, at least someone reported this to the feds. And so the feds came in and did an investigation. And here's the interesting part about the case. The investigation explicitly stated that there was absolutely no proof that those boxes had been tampered with. They were still taped up, no signs of visible signs of having been tampered with. But still, the medical practice was fined $750,000 for that little stunt. And the reason for that was they said you exposed it to being disclosed inappropriately. It didn't matter whether or not it actually was disclosed. The mere fact that you exposed it to that potential was bad enough to get a fine imposed. So very interesting case, and it does serve as a powerful reminder that paper is protected under HIPAA. Next slide, please. So what is health information? Again, it's got to be individually identifiable. Can you tie that piece of information down to one specific person? And I'll give you an example of that. Whenever I was privacy officer for Department of Social Services, I gotta admit to you, one day I was bored. I think it was a Friday. It was at the end of the day. Didn't have quite enough time to get started on another big project. So I got a little bored, pulled up Google, started Googling things. And out of curiosity, I thought, well, let's Google Scotty Allen, my name, and see what happens. So I put my own name into Google, hit return, and what do you know? It turned up all sorts of interesting things. It turned up, obviously, references to me, but it also turned up references to a Scotty Allen who races cars here in the state of Missouri. And there's a gentleman who is a dog sled racer named Scotty Allen out there. And so obviously these people lead much more adventuresome lives than I do. But this little exercise actually led to an epiphany for me under HIPAA, and that is, hey, wait a minute, people do have the same name. And so for those breaches where we've just disclosed someone's name and there's no other piece of information attached to it, so you don't have an address, you don't have social security number, you don't have any other identifying numbers, if that's a fairly common name, to me, that's not a breach, because who knows how many Bob Joneses are in the world, or how many Sally Smiths are out there. So those are the types of analysis that you have to do whenever you're determining whether or not it's individually identifiable. Can you tie that down to one specific person? It's got to relate to their past, present, or future medical care, or the person's physical or mental well-being. And I like to put it that way to you because HIPAA covers a whole lot more than what you might expect. It's not just going to the doctor or going to the hospital. It's also covering things like substance abuse counseling or family counseling or going to the dentist. Anything that deals with the person's well-being is going to be covered by HIPAA. It also relates to the payment for any of those types of services. So obviously that's going to be your health insurance information or how payment was rendered. And then also the operations that support the delivery of either payment or treatment. And so, simply saying someone was life flighted, that would be HIPAA protected. Saying someone rode in an ambulance would be HIPAA protected, even if you're not even mentioning why they were transported in one of those mechanisms. So a lot more is covered under PHI than you might normally expect. Next slide, please. Now, here's some of the things that could be in PHI. Obviously, names could be. Again, watch out for the common name issue, though. You know, if it's a real common sounding name like a Robert Jones or something like that, then maybe it's not individually identifiable. But as you can see, all sorts of different things could be in there, like your street addresses, city, county, zip codes, dates of birth, date of death. I also like to point that one out because I think most people assume, and this actually just came up yesterday here at my job. Someone asked me, hey, when you die, your privacy rights die with you, right? No, actually they don't. They survive you by 50 years. And believe it or not, that's actually the Fed's cutting us some slack on that issue. It used to be that it was HIPAA protections went indefinitely beyond your death. They've cut that down a few years ago to 50 years. So yeah, thanks for the break there, huh? Phone numbers, fax numbers, email addresses. Next slide, please. And then, of course, you get into the really identifiable stuff like your social security numbers, medical record numbers, that kind of stuff. So when you're dealing with medical records, you really got to watch out because there are tons of different identifiable numbers attached to medical forms. Social security numbers, and then patient numbers, medical record numbers, all kinds of different things. So always got to watch out for those numbers. And kind of the wave of the future I like to point out too is going to be biometrics. Someday we're going to be talking about voice imprints, retinal scans, fingerprints, all kinds of different things. And if you think that's a long way off, it's really not. The Department of Social Services is already going to a fingerprint system for their EBT cards, and that's their food stamp cards, basically. So these things are not way into the future. They're actually right at the doorstep. Next slide, please. So, little pop quiz here for you. Our quizzes will work this way. I'm going to read you the questions, and then we're going to open up a poll. Now, you'll notice the poll questions are slightly different than what you're seeing on the slide here, and that's because we have a character limit in the poll. So we couldn't basically write the exact same question out. We didn't have enough space, so we kind of condensed it down. So they'll look a little different in the polls, but it's the same question. So don't worry, we'll go through the answers on each of these after you've had a chance to answer them in the poll. So first question is, if you disclose that 35 people here in the city of Jefferson City, Missouri have COVID-19, would that be PHI? Next question, would it be disclosing PHI if you disclosed that a person named Quantum Jones took NyQuil for her cold last night and feels much better today? Give you a few moments to answer that in the poll. If you would please answer the poll. Okay. Okay, I'm ready to proceed when you all are. Okay, let's go through the answers real quick here. Would it be PHI to say that 35 people in Jefferson City have COVID-19? No, it would not be. And the reason for that is it is not individually identifiable. If you've never been here, Jefferson City is a fairly robust city. We have about 45,000 people here in town. And so picking out just 35 from such a large population base, no, that would not be individually identifiable. Now, if there were only, let's say, 50 people that lived in Jeff City, okay, now we're getting much closer to being individually identifiable. So kind of gives you a feel for it. Now, would it be disclosing PHI to disclose that Quantum Jones took NyQuil for her cold last night and feels much better today? Absolutely. First of all, Quantum Jones would be a fairly unusual name. I suspect if you Googled that, there would only be one here in the state of Missouri. And then besides that, we know that she had a cold. We know that she took NyQuil. That's health information all over the place there. So yes, absolutely, that one would be disclosing PHI. Next slide, please. So let's move on to how HIPAA allows us to share people's information without their consent. Now, I always like to point out up front that if you have someone's consent to disclose their information, you're never wrong. So I can't tell you how many times I've been asked, Scotty, should we get consent? And my answer is always the same. You're never wrong to get someone's consent. Now, if they don't give it to you, then that's when you have to turn to the law and find out whether or not you can disclose it without their consent. So we're going to talk about those ways in which you can share without their consent now. Next slide, please. Again, HIPAA is not the most user-friendly system. It divides up there are two sections that talk about when you can disclose people's PHI without their consent. This is the more exhaustive of the two sections, 164.512. And as you can see, there is a whole laundry list of reasons why you can share someone's PHI. The more frequent ones that come up is, first of all, required by law. If there's a law out there that says you have to disclose this information, then you would obviously need to do so. Probably the most prevalent situation for you all out there in the audience that would be required by law would be an elder abuse investigation. If our friends over at Department of Health and Senior Services come in and conduct an investigation of a client that you're serving and they say, okay, we need to see this patient's file, absolutely turn it over to them. They need that information to conduct their investigation. Some other more common instances would be like judicial or administrative proceedings. So if you receive a subpoena or a court order to turn over information, obviously you have to comply with those things. That's very much akin to required by law, really. And then law enforcement purposes, of course, if the police come in or the sheriff's department and they're investigating some sort of crime and they need access to your files to prove that a crime was committed or that it was not committed, then obviously you could turn that information over to either the police force, the sheriff's department, or the prosecuting attorney's office to be able to process that case. So those are the more frequent ones that come up under 512. Next slide, please. Now, 164.506, it covers what I consider is probably the lion's share of the disclosures that you need to make without getting someone's consent. And they fall under three exceptions: treatment, payment, and healthcare operations. And so we'll talk about those in turn here just shortly. But the one thing I want to note for you is these disclosures do not have to be tracked. And you might be thinking, tracked, what are you talking about? Well, HIPAA requires us to maintain a record of every time we disclose someone's PHI to an outside party. Now, there are exceptions to that. You don't have to keep track of every single disclosure, and these three examples are a perfect example of that. And you don't have to keep track of these disclosures. We'll go through each one of these in turn so that you have a good understanding of each. Next slide, please. There we go. Thank you. Treatment is just what it sounds like. Taking the patient to the doctor, or maybe taking them to a specialist. Maybe it's consultation between different healthcare providers. So any information that needs to be shared between those providers is absolutely fine. It's covered by the treatment purposes exception. Next slide. Payment, again, sounds very much what it is. It is collecting payment or providing payment for medical services. It could be seeking reimbursement for medical care. It could be collecting premiums. It could be health insurance coverage. So whatever mechanism is covering the payment portion of the medical care, if you have to share information to get that payment rendered, then absolutely feel free to. So, obviously the health insurance company is going to want to know, okay, what did you do to this patient that requires us to pay for it? So sharing that information is clearly fine under this exception. Next slide, please. This is the difficult one. Healthcare operations is kind of a nebulous category. It's all sorts of different things, administrative, financial, or legal in matter. It's also covers a lot of your business management types of activities. At first, I hated this exception because I was like, goodness gracious, look at all that madness that they're trying to keep track of. But over time, I've grown to love it because it is so vague and nebulous that you can really kind of shoehorn all sorts of things in here that may or may not be what they intended. But some of the more common things that come up here is like training. If you're training a new employee, you can certainly use an actual case file to do that, to kind of walk them through. Here's what a normal case looks like. Referring for legal services. So, heaven forbid you ever face a lawsuit, but if you did, when you hired the attorney, it would be completely fine to share whatever information was necessary with him or her to represent you on that case. Quality assessment types of investigations. So let's say the Board of Nursing wanted to look at records to see if a nurse had conducted themselves appropriately, that would be fine. Or same with a doctor or a dentist or a psychologist, what have you. Any of those licensure types of issues would fall under this sort of thing. Underwriting activities. Next slide, please. And then here's some other ones that might fall under their medical reviews. Let's say we're going to look at a patient's health history to determine whether or not a treatment's appropriate, or should we continue that treatment. So those sorts of things would be covered by this. Fraud and abuse investigations. So if the state or the federal government is investigating a fraud allegation or an abuse of a patient type of situation, we can share for those sorts of purposes. Business management, if you're talking about where patients are located, and so you're trying to figure out what's the appropriate staff coverage types of issues, those sorts of things would be covered by this. So all sorts of different things fall under this exception. And like I said, at first it's kind of daunting to look at all these different things, but then after a while, like I said, I've grown to love it because I'm like, wow, you can fit all kinds of things under here. Next slide, please. Now, obviously, no operation nowadays is standalone. You're always going to be working with partners to provide services to your clients. And so you might wonder, well, how do we share people's information with our partners that are also serving these people? That's what you call a business associate. And we'll get into that with the next slide, please. A business associate is a person, a company, a firm, could be a government agency that's performing a function on your behalf that requires them to create, receive, maintain, or transmit PHI. Oftentimes, a business associate can be another covered entity, and that's a very common thing. As a matter of fact, I kind of like those sorts of arrangements because then that other side, that other party is playing by the same rules that you are. So it's kind of, to me, it's nice to have another covered entity as your business associate. Next slide, please. And what a business associate agreement does is it basically sets out the rules of how information can be shared between the two parties. So it basically says, here's the information we're going to share. Here's how we expect you to protect it. Here's what we expect you to do in the event that something happens to it. Kind of sets out the basic rules. And if you put all those provisions into a document, you're probably at least going to be looking at around 3 to 4 pages. However, I will note for you that the feds have a recommended business associate agreement that they recommend that you use, and it's around 7 pages long. And the reason why I'm emphasizing that word recommend, I can guarantee you if they come in and inspect you and you're not using their recommended agreement, they're probably going to find you guilty of some sort of infraction. I can almost guarantee that. So anytime the government recommends you do something, I highly recommend that you do it. And so, yeah, I've given you the link there on the slide to where you can find that template business associate agreement. And what I've done personally here at the state level is tinkered with it a little bit to make it fit our situation, but for the most part, I left it completely alone and just have gone with their recommendation. Next slide, please. Now, no matter who you share information with, even if you have consent to do it or if you have a legal justification for it, the minimum necessary rule is typically going to come into play. And that is, even if you have a reason to share people's information, that doesn't open the floodgates and mean you can share absolutely everything about them. The minimum necessary rule basically says you only share whatever information is necessary to accomplish this particular purpose, whatever that purpose may be. Now, there are going to be some instances where the purpose is so broad and all-encompassing that you might actually have to share everything about their health history. But if they're wanting just information on an ankle sprain, then obviously the fact that they broke a collarbone is not going to be relevant to that, so you wouldn't share that under the minimum necessary rule. So that's just kind of a principle to always keep in mind, is let's only disclose what we absolutely have to. Next slide, please. All right, time for yet another quiz. This will work just the same way as the last one. I'll read through the questions, and then we'll open up the polls so that you can put forth your answer. Again, the question won't match exactly, but you'll get the same gist from each one of them. So question number 1, is it a permissible disclosure to disclose client PHI to DHSS personnel investigating an elder abuse hotline call? Question number 2, would it be a permissible disclosure to disclose an entire client medical file to a care provider who is also providing care for the client? And third, would it be a permissible disclosure to disclose client PHI to a subcontractor also providing treatment to that client? Give you a few moments to go through the poll.
Thanks. This is Eric. I just wanted to announce we'll keep the poll open for 2 minutes.
All right, let's go through each one of these. Would it be permissible disclosure to disclose client PHI to DHSS in personnel investigating an elder abuse hotline call? Absolutely, it would be a permissible disclosure that is actually required by state law, so you would be absolutely fine to give them whatever information they need. Would it be a permissible disclosure to disclose the entire client medical file to a care provider also providing care for that client? Absolutely it would. You might think that this might be a violation of the minimum necessary rule, but in my humble opinion, medical care providers know what information they need, and they know how the body all works. So I've never questioned their judgment. If they say they need the whole file, I give them the whole file because they're the professional. Would disclosing client PHI to a subcontractor providing treatment to the client be permissible? Absolutely, assuming, of course, that you have the business associate agreement in place. So as long as you've got that paperwork in place between the two organizations, that would be completely fine. And arguably, you could say it's also covered by the treatment exception as well. So absolutely fine. Next slide, please. Okay, now let's talk about a breach and what happens when there is one, and what our obligations are in terms of what we have to do in reaction to a breach. Give you a little second there to enjoy the joke. Good stuff. Next slide, please. Okay, a breach is an unauthorized acquisition, access, use, or disclosure of PHI that compromises the security or privacy of the information. And right there is the key. Did it compromise the security or privacy of the information? Give you a golden example, or a very classic example of a breach that otherwise would be a breach, but you could obviously say it didn't compromise the security or privacy of the information. And that is something that happens all the time. And that is, let's say a primary care doctor is sending out a patient to go see a specialist. They go to transmit the patient's medical file to that specialist, and they get it mixed up in the transmission, send it to the wrong specialist. Well, that other specialist is covered by HIPAA as well. They are obligated to protect the information just as much as any other doctor, so they would be covered by HIPAA as well. And so you could say that didn't compromise the security or the privacy of the information. That kind of stuff happens all the time, especially at the government level. Trust me, I can tell you that that's a pretty common occurrence. Now, give you a little story along those lines, though, of something that was kind of freakish and happened a few years back. I was completely caught off guard by this. Our folks over, when I worked at DSS, our folks over at Medicaid went to send a patient's documentation to a doctor. They pulled up the doctor's information. Doctor didn't have electronic communication set up, so they had to fax it. And they had a fax number for this guy. They faxed him the information, and a few minutes later, they get a call from a bowling alley saying, "Hey, why did you send us this patient file?" Oh, that's a problem. So we did some investigation, and what we discovered, I had no idea that this was even possible, but the phone company had reassigned that number to somebody else, and the doctor had failed to update the information with us. So the information we had on file was accurate, but that number now belonged to a bowling alley and not to him. And wow, talk about a very strange occurrence. We went ahead and reported that, even though it was not our fault, but we just wanted to be on the up and up with the feds and let them know, hey, this did happen. But yeah, shows you how breaches can happen and be something well beyond your control. So next slide, please. Now, I like to split a little hair here with you and differentiate between a disclosure and a breach, because I think when people say disclosure, they think, oh, that's a bad thing. Not necessarily. Disclosures are fine as long as they're either permissible under the law or you have the patient's consent to make that disclosure. So not every disclosure is a problem. It's the unauthorized disclosures that are a problem. That's a breach. And disclosures can take place in a number of different ways. It could be just handing someone a file. It could be shooting someone an email, sending out a letter or something through the mail, that sort of thing. It could be something beyond your control. Let's say you have a case file in your front seat, somebody breaks in the car and steals the case file. Believe it or not, these things do happen. That's still a breach, even though you had no control over the situation. Or let's say it's completely an accident. You put the file up on top of your car, you get into your car, forget about it because you're fighting with the seatbelt and the coffee and all that good stuff. Drive off with the file on top of the car. That's still a breach, even though it was completely an accident. So not every disclosure is a breach, but every unauthorized disclosure is going to be a breach. regardless of intent. Next slide, please. Now, when you have those breach situations, those unauthorized disclosures, you are required by the law to notify the affected individuals no later than 60 days from the date you discover it, or as soon as possible. And the reason why I've bolded and put it in red, as soon as possible, I've been investigated several times over the years since I have worked for the government, and as you might suspect, the government makes quite a few mistakes. And so every time I've ever been inspected, the very first question out of their mouth was, how long did it take you to make notification and why? And they didn't care if it only took me 2 days or if it took me 59 days. They wanted to know how long and why in every single case. And any case that involved a very small number of people, let's say only 2 or 3 people, and it took me like 40 days, 45 days, something like that, then they really got uptight with me. Why did it take so long for you to make notice like that? I apologize, my phone is going off there. So even though it says you have 60 days, there we go, got the phone silenced. Even though it says you have 60 days, the real standard that they're going to use against you is as soon as possible. So if you've got a very small breach of just a few people, they're going to expect you to make notification very, very quickly. As soon as you find out, they want you to be sending out those letters. Now, give you a story on the other side of the extreme. We had a breach when I worked for DSS a few years back that involved 30,000 people. And it took me 57 days to make notice in that case. Again, the feds came in. Why did this take so long for you to make notification? Then I explained to them that we had to sort through 2.3 million computer transactions to figure out which ones were the breaches. Once they heard that, then they backed off and said, okay, all right, that's not so bad then. 57 days, considering how many potential breaches you had to sort through, that's fine. By the way, it wasn't just me sorting those, it was 12 of us. We had a team of 12 sorting through all these computer transactions, trying to figure out which ones were breaches. That was a good time had by all, I can assure you. Now, not only do you have to notify the affected patients or persons, but you also have to notify the feds, at least on an annual basis. So if you involve 500 people or more in the breach, you have to notify the feds immediately. If it's under 500, then you only have to wait. You only have to notify them sometime within the year, and the year ends. The reporting year ends on the 28th of February every year. So all your breaches for 2020 have to be reported by February 28th of 2021. And you know, you can wait all the way till February if you want to, or you can just report them as they occur. Personally, if you don't have a lot, I recommend just reporting them as they occur. That way you don't miss one along the way. I can't tell you how many times I've had breaches where I was watching the numbers stack up and I was praying to God we didn't get to 500. And there was one where we actually came in at 497. I was like, yes, thank you. Avoid that notification to the feds, or at least that immediate notification. Now, if you go over 1,000 people affected by the breach, then state law kicks in. 407-1500 says if you breach the information of over 1,000 people, you have to notify the Attorney General's office as well. I can tell you this, I've had to deal with both, and the state folks are a whole lot harsher than the federal folks are. Kind of caught me off guard there. I was expecting the state people to be a little more relaxed about things, but no, they were much harsher than the federal folks. Now, if you go over 500 people or 1,000 people, depending on which law you're looking at, you also have to notify the media. In most cases, you know, breaches have gotten pretty common. The media is not going to pick up on most stories, but if it's something fairly egregious, you know, dealing with the elderly or veterans, that kind of stuff, then they might pick up on the story. But that, give you an example, that breach that we had at DSS for the 30,000, we notified every press outlet in the state of Missouri, and I think about 5 of them picked up the story, and they didn't make a big deal out of it either. It was just kind of, hey, this happened type of thing. So now your business associates are also required under the business associate agreement and by the law itself to report all those breaches either to you, or you can set it up in your business associate agreement where they report all the breaches directly to the feds. Either way is fine, just as long as one of the two parties reports them. Next slide, please. Now, here's some things you can do, some practical tips to avoid breaches. You can have encryption software for email if you're going to be sending PHI or other sensitive information through email. I highly recommend that you get some sort of encryption software. There's a number of different commercially available products out there. I'm not going to endorse any of them in particular. I can just tell you there are a bunch of them out there. They range in price, and I would imagine just like anything else, you get what you pay for. So you may not exactly want to go for that very cheapest option out there, unless of course that's what you just have to do. But yeah, that's where I would recommend that you go. Just Google it and see what you can find out there if you need that sort of thing. Do not discuss participant information in a manner or location where it can easily be overheard. I can't tell you how many cases of that I've had to investigate where people are just out talking about people's information. One of my favorite stories, by the way, was an employee had a particularly rough day, went to the bar on the way home and was shooting the breeze with the bartender about what a terrible day she had had. And she starts railing on this patient. And this bartender goes, "Oh, somebody like that doesn't exist. Who are you talking about?" And so she named the patient to the bartender. And guess what? It turned out the bartender was the son of this patient. Yeah. Couldn't make that up, huh? that was a fun one to investigate. But anyway, so that kind of stuff, yeah. Just if you're going to talk about your caseload or what kind of day you had at work, just keep it de-identified. Just say, yeah, I was dealing with the patient today, blah blah blah, and don't name any names. Put papers or files containing PHI in your desk when you're leaving the room, or lock the door if you have that capability. And same if you're taking it outside of the workplace. Make sure it's secured someplace. It's not just sitting out where anybody can get to it. So if you leave it in the car, lock the car up, put it under a seat, put a coat over it, something where it's it's concealed and it's not just an easy target for thieves. If you have a trunk, that's the ideal place. Just put it in the trunk. But same at home too, by the way. Don't leave case files just laying around. I unfortunately have investigated a number of cases where soon-to-be former spouses, I'm sure, had called in saying, my wife brings home case files and leaves them laying around. I go through them, and yeah, great, thank you. Yeah, wonderful spouse there, huh? Anyway, so yeah, that sort of thing. Laptops, smartphones, make sure those are encrypted or password protected, so that people can't just pick it up and start digging through your electronic records there. Dispose of documents containing PHI or other sensitive information in locked shred bins. If you don't have a locked shred bin in your office, I highly recommend you get one. And when I say locked shred bin, I don't mean that the actual shred bin has to have a lid and a lock on it. I mean, either the facility around the shred bin is secure, or the shred bin itself is secure. One of the two. As far as cleaning crews go, I get asked this question a lot. What about the cleaning crews? Well, if you have a business associate agreement with your cleaning crew, everything should be fine. And last but certainly not least, that last bullet there, by far the most common breach situation I've ever had to deal with is mismailing. So make sure you're putting the right letter into the right envelope. Make sure you got the right address. Now, if the client fails to update their address with you, that's on the client. That's not your fault. But as long as you're using the most up-to-date information you have, you should be good. Next slide, please. And there are penalties, of course, for failing to comply with HIPAA. You have civil penalties, and they're based on a three-tiered system where the least egregious breaches are $100 per violation, up to the most egregious, which are $50,000 per violation. Now, the key words there are per violation. What they mean by that is per piece of information, because every piece of PHI is considered a violation. So think about some of your standardized forms, or even worse, think of like an Excel spreadsheet, how many violations you could have on an Excel spreadsheet. There could be hundreds of them on there. So even at $100 a pop, that can add up really quickly. Now, as you can see there on the slide, there is a $1.5 million cap per year, but still, who's got $1.5 million sitting around, right? Exactly. Moving on to the criminal penalties, again, that's a three-tiered system based on the egregiousness of the incident. Fines ranging from $50,000 up to $250,000. Prison terms ranging from 1 year to 10 years. Now, let me set your fears at rest. I've never seen anybody prosecuted for an innocent mistake. All right, every HIPAA case I've ever seen prosecuted and somebody went to prison was tied to identity theft somehow. So people using PHI of people to steal their identity or to defraud the government, that kind of thing is what's going to end you up in prison, not just accidentally mismailing a letter or missending a fax, that sort of thing. So don't let that scare you. The criminal penalties are out there, but they're not really aimed at people making honest mistakes. Next slide, please. Okay, time for yet another poll here. This one has 3 questions, if I remember correctly. So I will go through these, and again, we'll open up the poll as we have the previous 2 times. So, is it an improper disclosure if a doctor accidentally leaves a report containing patient names on the roof of her car as she drives away? That report is subsequently found by a Good Samaritan who returns it intact to the doctor's office. Would that be an improper disclosure or a breach? Question number 2. Joan is an employee of a federally qualified health center. One day out of curiosity, Joan accesses information in her employer's database and views PHI not within the purview of her role within the organization. Is that an improper disclosure or breach? Next slide. Yeah, I thought there was 3 on this one. And then the 3rd question, an office assistant at a local clinic accidentally places a letter to a patient into an envelope addressed to a different patient. Would that be an improper disclosure or breach? Give you a couple of minutes. All right, there on that first one. Doctor leaves a report on top of their car and drives away. It's subsequently found by a good Samaritan and returned intact. Would that be a breach or an improper disclosure? Absolutely, it would be. This one's based on a real life scenario, and I threw in the good Samaritan part because that's what they used to argue with me about. They're like, what? We got it back. Everything was there. What's the problem? I'm like, yeah, how did you get it back? They had to open the file to see what it was, right? To figure out where to return it. So yes, absolutely, that is a breach. Joan, the employee, getting into the database out of curiosity, viewing PHI for no business related reason. Yes, absolutely, that is a breach. And can't speak for your organization, but every organization I've ever worked for, that is the quickest way to get yourself fired right there, is to start playing around in the database for no particular reason and just looking at people's records for fun. Next slide. Number 3 there, office assistant accidentally placing a letter to a patient into a envelope addressed to a different patient. Yes, like I said during the presentation, that is by far the most common breach situation that I see, and yeah, that's clearly a breach situation. Now, if it came back unreturnable by the, or undeliverable, I mean, by the postal service, then you've got a decent argument to say that that's not a breach. But, you know, if somebody's there at that other address, you're probably looking at a breach situation. Next slide. Now, under HIPAA, participants do have the right to access their file. So any records that you maintain on them, they do have a right to access those records and see what you have in your files on them. You have to grant that with that access within 30 days. So the 30-day time limit can be somewhat problematic if you share client records across other different providers. You know, so it might take you a little time to gather the stuff up, but if everything's done in a centralized location, 30 days ought to be plenty of time to be able to crank those records out and get them a copy. Likewise, the client has a right to designate anyone they choose to be their personal representative. So when you see personal representative, I think a lot of people think of an attorney or, you know, a guardian type of situation. No, it can be literally anybody. They can pick anybody off the street to be their personal representative. And as long as there's no evidence of coercion or abuse going on, you have to respect those choices. So if they give you a form saying, I hereby designate this person to be my personal representative, then that personal representative can access the person's information just as much as the individual, him or her itself, can. The flip side of the same coin is they also have the right to disclose their information to anyone of their choosing. And again, if there's no evidence of coercion or abuse going on, you have to respect those wishes. So if they want to disclose it to a complete stranger, then absolutely, that's their right to do so. And then finally, like I alluded to earlier, on the tracking issue, people have a right to an accounting of their disclosures. So they can come to you and say, I want to see everybody you've shared my information with. HIPAA gives them that right going back 6 years. So for 6 years prior, you have to tell them, here's everybody we've disclosed to and when we did it, what we disclosed and why we did it. So that's their rights. Next slide. Okay, now, as I often tell my boss, here at this job and every other job I've ever had, HIPAA is really the least of your concerns when it comes to confidentiality. And I know you're thinking, what? Least of my concerns? Here's why. Let me show you. Next slide. This is a laundry list of all the confidentiality laws that I've ever been able to round up that apply here in the state of Missouri. So you have all of these. Next slide. All of those. Next slide. All of those. Next slide. All of those. Next slide. And these. Next slide. Don't forget these. Next slide. And those. Next slide. Next slide. Yeah, exactly. Now you might be thinking to yourself, why in the world did you just show me that huge laundry list of different statutes and regulations and whatnot? As I say here on the slide, the point is pretty much everything in your case file is confidential under something. And so my recommendation is that you treat it that way. get authorization for you to disclose it. And if you don't have the person's authorization, then look for some legal justification for it. Otherwise, don't share it with anybody. Next slide. Now, I am going to cover a few of those in a little greater detail. 407-1500, which I referenced earlier, is basically Missouri's version of HIPAA. This is the one that says if you have a breach affecting over 1,000 people, you have to notify the Attorney General's office. The difference here, though, is Missouri's statute is a little broader. Well, it's actually considerably broader than HIPAA, because not only does it protect health information, but it protects anything that is called personal information. And the way they define personal information is anything that deals with the person that makes it individually identifiable, such as unique identifying numbers like DCNs, social security numbers, driver's license numbers, bank account numbers, all those sorts of things that tie it down to one individual. So it's much broader in application than would be HIPAA. Next slide. Medicaid, if you have a patient or a client that is receiving payment through Medicaid, any information pertaining to that Medicaid coverage is strictly off limits. Can't share that with anybody. Next slide. And same with public assistance. So if they're on food stamps or energy assistance programs, those sorts of things, all that information is off limits and strictly confidential under the law. Next slide. Substance abuse information is really a tangled mess, and it's somewhat amusing to someone like me, at least. Earlier this year, they put out this thing, hey, we're clarifying the rules on substance abuse. And so I read the new rules, and I'm like, yeah, that's no clearer than the previous one. So they thought they fixed it this year, but they didn't. But really, my snapshot encapsulation of this subject for you is, if you don't have a court order or the person's permission to share that information when it comes to substance abuse information, don't share it. So if you're dealing with an alcoholic or someone who has a drug problem, if you don't get their consent or you don't have a court order to turn that stuff over, do not turn it over to anybody. Next slide. For those that are interested, there are some state statutes that cover very specific subjects, such as most of them dealing with pregnant mothers or newborns. Next slide. And here's the federal law, just to give you the reference and to give you the down and dirty on it, the scoop as far as what it specifically says. But to save yourself all that trouble of reading, just take my word for it. Either get their consent or a court order, otherwise don't share it. Next slide. And sharing information with healthcare providers. If you're treating a patient between healthcare providers, they obviously need a complete understanding of the person's health. And so again, I know that minimum necessary rule is out there, but my humble opinion on this subject is give them whatever information they ask for, because they know what they need to treat that patient. So don't worry about the minimum necessary rule in this particular context. Next slide. And just a little plug for my current employer, because I know you all deal with or come across people who have military affiliation. Either they serve themselves or they're married to someone who did. Here at the Missouri Veterans Commission, we operate 7 veterans homes throughout the state. There's the locations there: Cameron, Warrensburg, Mexico, St. Louis, St. James, Cape Girardeau, and Mount Vernon. We also operate 5 veteran cemeteries throughout the state: Springfield, Fort Leonard Wood, Bloomfield, Jacksonville, and Higginsville. We have veteran service officers located in pretty much every county. We have every county covered, let's put it that way. Maybe they're not physically located in that particular county, but they do make business trips over to it to cover clients in those areas. And these are the folks that you want to talk to if you have someone military affiliated on your caseload that needs the assistance, because our veteran service officers are the ones who help them figure out which programs they are eligible for and and help them put together the applications necessary to get themselves these benefits. And so one thing that we always like to emphasize when it comes to veterans benefits, these are not welfare. You'll hear that a lot from veterans. They're like, oh, that's for poor people that need the help. I don't need it, that sort of thing. No, these are benefits that they've earned strictly because of their service. And when we say veterans, we mean anybody who's ever worn the uniform, not just necessarily people who have gone to war zones or gone overseas, that sort of thing. So any military affiliated person is probably eligible for something. And so I'd highly recommend you hook them up with one of our VSOs and let's figure out what help we can get them and what benefits we can get them. Obviously, when it gets to the point where they need that 24-hour skilled nursing care, look at our veterans homes. I would highly encourage that you apply for admission to those early because we do have a waiting list. It's not a huge waiting list, but we do have a waiting list for each one. And then, of course, when it comes time for that final resting place, our veteran cemeteries are outstanding. And to give you an endorsement of those facilities, I'll tell you this. I went to a funeral at the Springfield facility a few years back and was so impressed I immediately changed my will to say I want to be buried there because it is so nice. So these are really good facilities. So I would highly recommend that you reach out to a VSO and let's see if we can get your military affiliated folks on your caseload hooked up with these benefits that are available to them. So next slide, please. With that, I will open it up to questions. If you have any questions of me, I'd be happy to entertain them at this point. Looks like we have a question from Steve Markley. I don't know if I have the ability to unfreeze him.
No,
Hello.
I couldn't get my computer, the sound on my computer to work. So, but I was able to dial in on my phone.
Oh, okay.
Man, that was the only reason I had my hand up.
Oh, okay, gotcha. All right, thank you. Good, I'm glad you got that worked out. Oh, okay, here we go. All right, we got all kinds of questions here. Oh, let's see. Okay, these are a lot of administrative types of questions. Not really. Yeah, these are.
Scotty, we can start with the Mears question. It's the third one. What would consist of not enough people with that name to be considered HI? I think they're talking about Quantum Jones.
Yes, exactly. I would say if you have two or more, you could say it's not a breach because then you can't tie it down to one specific individual. But if you can only find record of one person named that, then that to me would be a breach because clearly it has to be this person.
Okay. Then we had a question from Deborah Ellis. Can we change an answer? You cannot change an answer once it's been submitted. We have a question about only one is a breach. I think that must have been related to a poll.
Yeah.
Yes, we have a couple questions. We know the poll said select one, but all three in that last poll were correct answers. So we will make sure that the scoring is correct. I think it was just a glitch in the format chosen for the poll.
Oh, what was the link for the recommended business associate agreement? I think you're going to send my slides out. Is that correct, Erica?
Yes, we will. We can do that.
Yeah. Yes. Okay. So yeah, you'll have that link available to you. And if not, if that link turns out to be outdated, by the way, just go to the Office of Civil Rights. Just Google Office of Civil Rights, and it'll take you to their website. Look for their HIPAA compliance information, and you'll find it under there. Okay. When you say elements of date except year, does that mean you can disclose someone's birth year? Yes, I believe you could. I believe you could disclose someone's birth year without it being considered a breach. And you know, birthdays is kind of a kind of an interesting issue. It's a hot topic of debate amongst us privacy nerds. Some people say it is a breach if you disclose someone's birthday. Others say it's not. I tend to be of the mindset it's not, because multiple people are born on the same day. So to me, just the birthday itself is not good enough. I think you have to combine it with something else, but you will meet somebody else, or other people, I mean, who will say, yes, a birthday is a breach. So kind of depends on who you're talking to.
And I think the next one we can answer is Jennifer Shotwell about the photographs.
What we got down here? Oh, okay, here we go. We often post photo. Yeah, very common, very common.
Well, I can read it out loud for everyone. We often post photographs of our senior center clients when in a public space. We ask permission, but have some background folks we didn't ask. Is that a disclosure or a breach?
Yeah, we have the same problem with our veterans homes, because obviously we want to toot our horn about the great activities that we're conducting for our residents, just as I'm sure that's what your purpose is as well, to show the great care that your clients are receiving. In our policy, and I tend to agree with this, I think you need to get the permission of everybody in the photo that can be identified. Now, if it's somebody in the background with their back turned, I wouldn't worry about that person, but if you can see their face, I think you probably ought to get their consent. And by the way, you can do that easily, like through the opening application documentation that you have with your clients. You know, maybe you just put that in there saying, you know, periodically we take photos. Would you object to us disclosing your image to the public? And, you know, give them the opportunity to give you a blanket authorization right there up front. Okay, now let's see. The next question here from Melody. It says, what about vehicles with the name of the company on a vehicle providing service in a patient's home? That is, yeah, that's a great question. It really is. Wow. No one's ever asked me that. That's a great question. I think you could make an argument that that is a breach, but I would never report that. And if the feds ever investigated something like that, I would laugh, because of course you have to have identification on your vehicle, and of course you want to be able to you know, advertise to people as you're driving down the road and that sort of thing. So I wouldn't worry about it, but yeah, I guess you could make an argument that is a breach. That's funny. That's a great question. Thank you for asking that. You know, and if you think about it, like an ambulance is like broadcasting to the world practically. You know, somebody in that home needs medical care. You know, hard to miss somebody with sirens blaring down the road and pulling into somebody's driveway. So yeah, I wouldn't worry about it personally.
Well, it looks like that brings us to the end of our question, we have no more questions. Unless anybody has anything else, please, I'll give you a couple seconds to pop it into the question box.
All right, well, in closing, let me just tell you, you're never bothering me to reach out to me. So, you know, if you have a question comes up later on, you want to just kind of bounce some ideas off somebody, feel free to reach out to me. You've got my contact information there on the slide. Give me a call, shoot me an email. Email is probably the easiest way to catch me, because I'm not at my desk a whole lot, but I'm happy to chat anytime.